Anaphylaxis and also injectors. Now, many people just refer to it as being an EpiPen. An EpiPen is a trade name, just like calling a vacuum cleaner a Hoover. There are different auto-injectors on the market. This one is the EpiPen, the most common used. This one is the American Jex pen, given license to be used in this country in November 2014. And this one, the Emerade pen, is made in the Czech Republic. All three of these are now currently in use. First of all, what is anaphylactic shock? Anaphylactic shock is when the body has the immune system of the body overreacts. It could be a reaction to food, medication, insect bites, or nothing. We have what we call idiopathic anaphylaxis. In other words, anaphylactic shock, have all the signs and symptoms without any apparent cause. Rare, but it does happen. The most common cause are food allergies. Nuts, especially peanuts, but it could be any kind of nut. Fish, especially shellfish, crustaceans. Dairy, although normally it's a lactose in dairy, but sugars that cause a problem. And eggs. Other common allergens in fruits, for example, pineapple, strawberry, kiwi, tomatoes. Essentially any fruit that bears its own seeds. In vegetables, asparagus, mushroom, spinach and celery are the worst offenders. We adopted the European Directive on Food Allergens in 2014, which highlights 14 different allergens. In reality, there are over 170. Essentially, one man's meat is another man's poison. If a person has severe allergic reactions, they will be prescribed an auto-injector. The person must carry it with them at all times. In some cases, the person will have two to carry, which indicates they would need a second injection within 5 to 15 minutes of the first. If the person has anaphylactic shock and an auto-injector is used, then the auto-injector goes with the patient to hospital. What we call anaphylactic shock was considered to be quite rare. But over the past 20 years, the number of cases have increased by 50%. Ordinarily, the person goes to hospital, will be discharged after 6 hours treatment. But nowadays, the number of people who need to spend at least one night in hospital has, over the same 20-year period, increased by over 400%. Where do you inject this? Well, the only place to inject it is in the outer upper thigh muscle, the largest muscle in the body. And yes, you can inject through clothing. Although I suggest if the child is wearing a pair of jeans, you just drop the jeans. Chances are, if you try to inject through jeans, you can damage the needle. The injection times also differ. With the EpiPen, for example, the injection time was reduced from 10 seconds by the manufacturers down to 3 seconds. That's in October 2017. The idea behind this reduction is to reduce the risk of laceration. The European Emerade pen, we now inject for 5 seconds. And the American Jex pen, you inject for 10 seconds. It's no longer really recommended that you massage the injected area once you've given the injection, because you can damage the underlying tissue of the skin. Historically, the first identified case of what we call anaphylactic shock dates back to the ancient Egyptians. In 2017, hieroglyphs were found, which date back to 2637 BC, and depicts a pharaoh having been stung by a flying insect. So that's the first recorded case. But this condition is becoming more and more prevalent.